Next is what does neurobiology says, okay, in terms of treatment of ADHD. So these are the circuits involved in ADHD, okay. So basically frontostriatal circuit, okay, frontal lobe striatum, okay, where for various symptoms this dysfunctional frontostriatal circuit is responsible for core symptoms of ADHD. So this is basically dysfunctional inattention, circuit in inattention, this is impulsivity, dysfunctional circuit in impulsivity, and dysfunctional circuit in hyperactivity. So what is the dysfunction in this circuit? Basically low tonic firing of dopamine and norepinephrine neuron in this frontostriatal circuit causes symptoms of ADHD. Are we missing this another circuit? Okay, this is subcortical circuit called as reward circuit involving nucleus accumbens. Okay, where this inattention in frontostriatal circuit causes inattention, hyperactivity and impulsivity, but dysfunction in reward circuit, poor phasic dopamine release in the subcortical circuit. Okay, this is another area where the dopamine release is dysfunctional. This is subcortical circuit. It causes poor reward mechanism in children with ADHD. If you see, this circuit is getting more and more prominence because many of the long-term outcomes of untreated ADHD has to do with this dysfunctional reward circuit actually. Okay, if you see, outcomes like obesity, increased obesity in untreated ADHD has been attributed to dysfunctional reward circuit. The ADHD children, when they are untreated, they involve more and more addictive behaviors. Like previously the addictions are like cannabis, alcohol, nicotine, but right now this more and more gadget addiction, gaming addiction, it has been on the rise, okay, and it is almost getting to a pandemic stage, okay, and untreated ADHD children has higher risk for addictions. The less social interaction, poor dysfunctional reward circuit lead to less pleasure from the social interaction, so they avoid more and more go into this addictive behavior. And chronic dysphoria is also one of the outcome of untreated ADHD. Okay, so this dysfunctional reward circuit has a role to play in the long-term outcome of ADHD. And the evidence, very variable evidence for cognitive remediations. Okay, so none of the guidelines, be it American Academy of Pediatrics or be it other guidelines, they have not recommended cognitive remediation as the treatment of core symptoms of ADHD. Even though the many centers take cognitive remediation, and there are many individual articles and meta-analysis in support of cognitive remediation, the evidence is quite variable. Okay, just by doing cognitive remediation did not improve core symptoms of ADHD. It can be used as a supportive treatment, and guidelines do approve behavior therapy as a treatment of core symptoms of ADHD, especially in preschool children. Okay, preschool children, the behavior therapy, that is parent trained behavior management, teacher classroom intervention, teacher trained behavior management is one of the first line treatment of ADHD for preschool children. Okay, so behavior therapy, it directly addresses reward circuit. Okay, so superior to behavior therapy, variable evidence for cognitive therapy, and these outcome variables point towards dysfunctional reward circuit in ADHD. When the ADHD is treated with stimulants especially, the reward circuit also improves. Okay, dysfunctional reward circuit also improves, leading to good long-term outcome.